Well, in Europe, the innovation in AI, it's maybe going slower than expected. And the reason for that is based on two main aspects. One is with the amount and quality of data, on health data we do need just to train and test and validate the AI algorithms. And there is a barrier on data accessibility, which maybe with the new European health data space, those issues will be solved. But up to now, every region, every country, even every institution impose so many barriers based on privacy and safety and concerns with data sharing that limits the AI development. The second main aspect we have to consider in Europe deals mainly regarding AI solutions with the reproducibility of the results. This is not only Europe, it's worldwide, but maybe in Europe is more relevant because there is a huge amount of developments on institutions, individual institutions or hospitals or academies where the AI tools work extremely well. But when you try to reproduce or expand those results to other places, then even using federated learning, you have troubles with reproducibility. We are so happy also that maybe these days there are solutions for that, dealing first with data harmonization. So many research groups are working on that. Also with advanced AI solutions that will minimize the variability within the data, not related to the disease, but related to how the data was acquired. And that harmonization process will foster AI innovation or translational approaches in Europe. So I do really think that in the next years, we are going to see an explosion of the universal approach in healthcare to AI solutions, and Europe may lead those aspects. Well, of course, any device or solution in medicine have pros and cons. And we have to not only take care on that, but also try to maximize the pros and minimize the cons. In my understanding, the most important aspects deals with equity. Whatever we train, whatever solution has to be trained in the for the people and with the people. That means that we cannot train a solution on a specific population and then not taking into considerations other populations or other groups or other ethnics or other disease expressions that are also within Europe. Of course, we have to think on the clinical impact. There are so many solutions that maybe are extremely good on the technical part. They are extremely advanced on how things were constructed and developed, but the usability or the clinical impact is not the expected one. So it's quite relevant that in whatever AI solution, physicians, engineers, AI developers, data scientists, we do work together to minimize the fail and to maximize the translation into clinical usability. I also do see that solutions need to finally help clinicians or physicians in their daily work. I mean, it's not a matter of with these solutions, we will not need a medical doctor to provide assessment or give the best treatment or perform the follow-up. I really do foresee AI as a benefit for physicians in hospitals and clinicians in their practice. And if we do think that way, the pros will for sure be much higher than the cons. I also do think that this is a complex field, AI, and performing research and trying to be innovative in clinical practice, there is a must to work in a multi-professional and multidisciplinary way. And we need to construct a network of collaborators when dealing with this process. That means that, of course, we need to take care, as in any device, and at the end, AI will provide solutions as devices to be used in clinical practice. Any device, we have to take care on how was it constructed, in which populations, from which places, how universal and representative was the data. Was it validated in other places with independent cohorts? Does it provide an overview of all the relevant aspects of the disease related to treatment and follow-up? And if we think that way, it's not only a matter of engineering or AI scientists, even data scientists have to be involved. Of course, IT people on the hospitals and university, pretty sure researchers and working groups leading ethical and legal aspects of what we are doing. But without the involvement of physicians, of medical doctors, since the beginning on the definition of the hypothesis to be solved, and on the pathway to be improved or facilitated, any AI solution will not succeed. So that's maybe one of the cons. No AI solution without involvement of medical doctors will have a real impact on what medical doctors are doing every day. And I do foresee that there is a must to develop AI on a collaborative way with a multi-professional network and being extremely transparent on all those aspects when we provide how the AI solution was constructed.